This is my video, which comes from a place where I'm losing hope. Who am I? I'm currently a Norwegian citizen and it's 2025. In the times between 2010 and 2020, I was part of a research program done by the Norwegian states, one of their biggest studying hospitals called Rikshospitalet. I have a very debilitating disease called hyperhidrosis, generalized in my case, which I wasn't aware was a diagnosis until I was admitted into this research program where I was diagnosed and then put on an experimental medication called Dridasa. The producer of this medication was Sanofi, and the drug was not approved by the Norwegian Medical Board, so it needed a special approvance and a purpose through that specific hospital to get it. It was really, really expensive, but it gave me a life quality I didn't know I would be able to have. I myself am a schooled medical professional. I have an advanced degree in behavioral analysis, and I've worked on behalf of other patients, vulnerable patients and their families, helping everyone I could until I myself got sick in 2020. It was then that I was, by coincidence, made aware of the fact that I've been wrong medicated by this hospital for 10 years. What I then discovered was that this is a medication recommended that you are not on for more than 2 years at a time, maximum dosage of 3 tablets a day. In 2020, I had been on them for 10 years successively, 6 tablets a day, and that's double doses, 8 years more than recommended. The hospital was aware of this, but I was never informed of it. I informed them of my high doses very early on, because I had to double up doses to get the same effect, but to get the dry life and to be able to unfold, get to know my own capacity in the way I did, was priceless for me. So some of the side effects I was experiencing were nothing to talk about compared to the life quality it gave me. To be specific, the side effect I was having was severe mouth dryness, which it can cause. Especially with my high doses, it somehow sometimes inhibited me to a degree where I was basically not able to eat. So you need to be very aware of that factor in regards to your teeth, and it's said in the medical leaflet that comes with the medication, which by the way was imported from Germany. I speak German. That you should be aware of this as a side effect, as a common side effect of the medication. And this has to do with how the medication goes through your system, in your parasympathetic nerve system specifically. For me, I thought it was a success story until I in 2020 discovered the high dosages and the potential damage it may have done to me. But because I'm a medical professional, my cause wasn't to place blame. My cause was to get help with mapping what it may have done to my health. Another huge factor for me was that I then also discovered that it may cause infertility and dementia, early onset dementia or cognitive impairment. So those two main things, because I am genetically disposed in my family for dementia, amongst other things, and my main dream since I was very, very young has been to get my own family and to get babies. And by then I had found what turned out to be the biggest love I could ever dream of finding. That dream was very, very important to me. So finding out those factors, I turned to the hospital with a very diplomatic presentation, and also because this was during COVID, I had a suggestion to them to do all the mapping necessary with the side effects in one day. I brought my sister-in-law, who is also a medical professional schooled in the same thing I am, to have her there as a witness and for her support, and she was amazing in that meeting. What ended up happening is that this specific hospital in Oslo wrote a statement report after that meeting, admitting to the wrong medication, but denying me any mapping. They argued that it was way too early on, after me stopping taking the medication, to actually conclude some diagnostics or findings from the overuse of the medication, which I just strongly disagree with. I also disagree and know for a fact that when you are a research facility, that basically means I'm used as a guinea pig if they don't want to follow up the damage it may have caused me when it's experimental to begin with. So I couldn't really fathom the response I was getting. Defeated by that, I don't stop looking, so I tried to find some other dermatology specialists here in this country, where I then discovered that there basically are none to very few that specialized in this. The ones who do, I contacted. I also contacted specialists in Sweden and Denmark who were willing and able to take me in there to their clinics and map me for exactly this. It can also affect your nerve system and other things. So I was really eager to get all of these things mapped back in 2021. That would have cost us 15,000 Danish kronas, which my country had left me by then in 2021. Without an income, because they did the failure by validating a doctor who at the time when I turned ill for the first time in my life didn't report accurately to the welfare department, and this cost my rights being frozen, and again us to be without income. This again led to us being homeless in the middle of all of this, twice for the second time in October 2021. It's insane the years we lived in between there, trying to fight to get any medical help, but they were willing to take me in Sweden and Denmark for a price of 15,000 kroner, which I applied the Norwegian state for and was denied. It was denied by the hospital, Rikshospitalet, with the argue, because they are the specialists on this field, ironically, so they had a say in this, and they denied me that help for that price, based on the fact that they said they had no knowledge of the actual clinic. I know they are verified. I'd done my research. I showed them research papers and everything about the clinic, and I was still denied the help. That is 5 years ago to the day. I'm now still sitting here. I'm back in Norway. I've become so ill. In the time between, I've gotten diagnosed with 5 smaller hernias in my neck. I also have a military neck. I have static migraines. That means my migraines never pass. I have no effective medication. And this summer, finally, I got a blood test done by my doctor, a SIP test, which proved that I had 2 genome deficiencies, which caused me to be basically immune or resistant against 90% of normative medicational use. I've been saying this for years. Now we can go back to Rikshospitalet, me reporting that I had to double my dosage to get the same effect very early on, and them not reacting to this at all. Calling me in to take a blood test was never done. The SIP test, which I'm speaking about, is important for anyone who experiences lack of results from medication that's supposed to help you, as it can determine and show why you might have some resistancy or actual findings that can underline and prevent you from being wrong medicated with tons of medication that will only ruin your organs, like it has mine. I'm now left here these years after, knowing a little more than I did then, but still I'm being refused mapping of my nerve system. I'm being refused something as basic as an MR done in anesthesia. The reason I needed an anesthesia is that I'm not able to lay on my back anymore. I haven't been able to for now 4 years. It makes me unable to breathe. That's because of the structure in my spine has become severe and very, very painful. In November, I got diagnosed also with something called allodynia, which is a very highly sensitive sensory overstimulated nerve system too, which causes skin and other things to be hypersensitive. And I've been also saying now for years that I can even feel the vertebrae in my spine when they touch my skin and how much it hurts. So there we have the explanation for that. I also have been diagnosed with fibromyalgia. Besides the hernias, I also have a hernia in my middle back. I have tears in vertebrae in my lower back. They've found something called Tarlov cysts on both sides of my sacrum, which can be also explaining cause for the pressurized sensation I constantly have. Being upward sitting causes my head to basically be pumping with pains as it is right now. And that can be explained by the Tarlov cysts, which I have actually had some trauma done to my body during the last years, which may have caused them to change position. And these are active cysts, so they can fill and change position. They can change the way they put pressure on your spine. I've researched this so much. I found any documents and related all the dots that I can. Contacted a neurospecialist in Oslo who I had a 2-hour phone consultation with. The reason I did it over the phone is that I'm not able to leave my house because I'm barely able to walk anymore. I'm crying because I used to be a very highly functioning human being. I used to train myself strong. I worked out 5 times a week because I wanted to become the strongest mom I could in the future for my kids. My latest diagnosis was given to me now in February, where I was diagnosed being infertile. And by actually going in and examining me, they found a huge tumor in my uterus, which needed to be removed surgically on the 13th of March. When they went in during surgery, they ended up having to also remove one of my ovaries. And they found that I was full of endometriosis. Here I have to bring you back to 2021 when we were left homeless on the street because the state made a mistake. And the hospital responsible for all of this wouldn't map me. I was having such pains each time I had my period that I ended up in the emergency room with big bleeds, pains that I can't describe, and then again medication that doesn't work on me. They did nothing besides send me home. They didn't map me, they didn't do an ultrasound, they didn't look into this. And what was now discovered in March of this year is said to have been there for years. So I've been living with endometriosis, which has been allowed to accumulate in my body and make me gradually infertile for 5 years. I'm trying not to cry because this doesn't deserve any more tears. My husband has been my rock for 5 years straight. He has stood up against big pharma and medical professionals across Europe, COVID-ridden, to get me the help I need and the mapping I need. And step by step, we've gotten some answers to why I'm in such severe pains. But still, there's a lot that's not been cleared. After having a 2-hour phone consult now recently with this neurospecialist, she was very clear that having been through the treatments I've been and living with chronic migraines my whole life, which now are static, and she knows all about my health history, she was very adamant that I needed to admit me at my nearbyest neurological department hospital to get my whole nerve system mapped. I was rejected that too, on behalf that they said that we don't see how she can profit from this without having met me, talked to the doctor, tried to look into any history, proper history. They just deny me. So I'm now actually in a position where this same doctor has referred me to do an MR in anesthesia with contrast to see if I have spinal leaks, which can explain my extremely high blood pressure, which I refuse to be medicated against. It's a symptom. It's not to be disguised. She has referred me urgently, but we're being denied help all over. It's about principles, it's about capacity, it's about which district I belong to. And as I see it now, I don't belong to anyone, anywhere anymore. How I can be a Norwegian citizen, having worked in the healthcare sector my whole life, taking care of everyone I love and everyone I could help. I've helped with everything I am, my whole active life, and here I am, asking the Prime Minister of Norway again why my life does not matter to you. I tried from the deep of me to ask you back in 2022 when we were fugitives. Jonas Gahr Støre in Portugal, my husband's home country, living in a small village. I asked you, does my life matter to you? I didn't get a reply. I sent one video. I'm not a social media person. I've been too sick to be on all of that, luckily. But here I am in need to do it again because nothing came from that. All I'm asking for is a solution and mapping to understand why I keep getting sicker and sicker and sicker. Is that too much to ask for? I worked and paid taxes since I was 13 years old. I now have a husband who is currently, as we speak, in a hospital being mapped for stress-induced epilepsy. This because he had a severe seizure during Christmas. That was our Christmas, while I was having cluster headaches in the next room. I couldn't move for 20 hours. Any movement caused me to vomit. Because of my structural pains, this makes everything just worse. My blood pressure, everything. So I was admitted at the hospital several times. At least I was in the ER. But now they have said to me, basically, we don't want you here anymore. The last time I was there was because I started bleeding from my eyes. I've been having an ear infection now for years, so I have intracranial pressure and pains that are just so severe. I'm tired of having to take medication against symptoms for something I don't know what is. I've done everything I can. Found all the specialists who know anything about this, who say this girl needs help, she needs mapping. And my own country refuses me again and again and again and again. How is this possible? But they're discussing gas prices and taxations. How is this possible? I'm asking you. When did we stop mattering in our so-called democracy? Currently now, my last symptom is that I'm not able to sleep. The guilt I feel for not being able to protect my husband from what happened to us during Christmas, and him now potentially having to live with this life-threatening disease, which epilepsy in that severe degree is. It's underlying in me. So every night if I am able to get some sleep, I end up dreaming with nightmares that I've never ever experienced before. It's a level of trauma that I didn't know was possible. I feel like I failed him. I feel like the only person who's chosen to love me unconditionally more than himself is now damaged and ruined by all of this. And it's breaking him each day. He cannot believe that we are in a country, in a world where I don't matter. We've been all over Europe asking clear questions to get answers to the problems I know I have. I explained it in every language, with every terminology I know, with every research I found. And the answers are clear. It's mappable. It's understandable. But I'm now in the round again by being rejected everywhere. The last rejection came this morning. So I'm now on a 20-month wait to get my nerve system mapped by the nearbyest hospital. The hospital that's closest to us doesn't even have a neurology department. So where am I supposed to go, and where will I matter? Because I will not survive this, Jonas. And neither will my husband. So I'm asking you again. Is it time to wake up? Is it time to make the people in this country matter again? Because what's happening? It's such a shame. It's a shame, and we're living a lie. We're living a lie where we are online thinking we're great. We have good numbers. We're going good. We're looking the same. We're buying Teslas. We have good income ability. But it's a lie. The poverty rates in Norway are daily on the rise, and I read and I see people struggling to matter in any way. I will tell the world out there right now how I daily read cases from hospitals all over Norway where patients just die. It becomes complaints that families aren't able to upkeep because the bureaucracy in it is too complex. They can't afford lawyers, they can't, for some reason, follow through the cases. But we are all statistics. We're all statistics. And people keep on dying daily. This has to stop, Jonas. It's enough. It's enough. I spent my whole life making a difference, and I will not stop now. But I need to be able to live, and you need to let me. So I demand an answer from you. I demand to sit down with you. You're welcome to come to my home, and I will explain to you how we're going to do this. We're going to change this country for what it used to be. For what I honor my grandfather who built this democracy. I honor him every day for everything he built, the safety we've lived in. And if he had been alive today to see me this broken and what happened, then the boys in the hood, like they used to call themselves, Gutta på skauen, there would have been repercussions, Jonas. The abuse needs to stop. Doesn't matter if it's women's health, men's health, mental health, whatever. We all fucking matter. And it's enough. It's enough. I refuse to become a statistic like you let everyone else become. And I will be heard. I will be heard. It's not going to take me becoming an influencer or writing a blog because I'm not capable anymore. I'm using fine motorics each day, which make me unable to write. I don't have a computer. I don't have the tools to influence anything. But we need to get offline and get into the real world because people are dying and you're allowing them to. That's on you. And your so-called government, who again are discussing gas prices, and you're closing down crucial institutions all over Norway in forms of psychiatric facilities, schools, things people need to feel safe and secure in a vulnerable situation. So what's going on? I'm asking you. Wasn't COVID enough? The virus wasn't COVID. The virus is fucking greed and big pharma. And it's gonna stop. I promise you it's gonna stop. I will fight with the last I am, but this stops. And it's gonna stop today. You're getting this, it's the 1st of April, so maybe you think it's a joke, but I really, really wish it was. You're getting this today, and I'm gonna get an answer, and I'm gonna get help, because I'm gonna get my life back and change whatever needs to be changed out there. You see me in the raw state a human being can be. So here I am. How much does my life matter to you? Do I matter at all? Not at the moment, but I'm gonna make myself matter to you. Because I'm not fighting just only on behalf of myself. I've lost everything I dreamt of ever being. That includes my human capacity, but you will not take my soul or the love that I have in my life. You've taken enough already. This stops. We're living in a broken country. And you're fighting to take care of fugitives from other countries. Image, greed, big pharma, oil. That's what it's about. And that puts everything we present ourselves to be as a country to shame. So shame on you, and I hope to hear back from you, because I know where the government is and I will not stop. I will have answers for every patient. We all matter. And guess what? The religion state that you are constantly putting together and segregating and abusing the value of, not anymore. Because guess what? We are religion, Jonas. It's about our beliefs. And I believe that this needs to be turned around. And I'm going to do that. I'm not giving up, but I need to survive to do it. So I will hear back from you. That's the least I deserve.